Hi, welcome to another Biomedical Engineers TV video. In this video, we will look into endoscope devices. Let's look where it all began. The endoscope, an instrument that allows us to peek inside of the human body, was used as early as the ancient Greek and Roman periods. An instrument considered a prototype of endoscopes was evidenced and discovered in the ruins of Pompeii. It was Philip Bozzini who, in 1805, made the first attempt to observe the living human body directly through a tube he created, known as a licklighter, a light-guiding instrument, to examine the urinary tract, rectum, and pharynx. In 1853, Antoine-Jean Desermeaux of France developed an instrument specially designed to examine the urinary tract and the bladder. He named it endoscope, and it was the first time this term was used in history. After a series of trials, Dr. Adolf Kussmaul of Germany succeeded in taking a look inside the stomach of a living human body for the first time in 1868. This was tested on a sword swallower who could gulp down a straight 47-centimeter long metal tube with a diameter of 13 millimeters. Now let's look into how modern endoscopy works. Endoscopes use optical fibers to produce an image of inside the body. A doctor can insert a bundle of optical fibers into the body. Some carry light into the body, and some carry light reflected off internal body surfaces back out. This allows the doctor to see an image of the inside of the body clearly and help them diagnose diseases like cancer or see what they are doing during keyhole surgery. The modern flexible endoscope is a complex, highly engineered medical instrument. Systems for air, water, suction, tip angulation, and the endoscope's basic controls are common across manufacturers and models. Differentiation is often in handling characteristics, breadth of product line, image quality, and the manufacturer's special features, insertion tube flexibility adjustment, image enhancement features, image documentation options, etc. RGB sequential endoscopes offer potential superior color accuracy but suffer from motion artifacts. Color chip endoscopes are more popular due to good color and natural reproduction of motion. Recent advancements in imaging include high-definition imaging, narrow-band imaging, and wide-angle close-focusing optics. An understanding of the basic components of the endoscope will help the endoscopist troubleshoot many equipment problems. Let's look into the components of modern-day endoscope systems. The modern-day endoscope can be divided into three different sections. First is the peripherals access inlet section, the second is the access port and control section, and the third is the distal tip of the endoscope system. Let's understand the major parts of an endoscope. Water container or irrigation bottle connector. The water container, cap, and tubing that are used for the insufflation of air and lens wash. The irrigation bottle refers to a water container and tubing and accessories that are used to flush water through the endoscope. Light guide. Flexible light guides make it possible to direct light from any chosen point, balancing any relative movement between the light source, the illuminated object, or the detector. Light guides consist of a single fiber or compact fiber bundles surrounded by a sheathing. Air pipe. The light source box also contains an insufflation air pump. The air is sucked from the light source box through one or two holes in the air pump and pushed from the air pump into the air pipe of the endoscope through a plastic tube. Because the air pump does not have a dedicated HEPA filter, transmission of microorganisms cannot be excluded. Gas tube connector. An insufflation system which provides continuous insufflation as a preset, limited low insufflation gas pressure, and a high insufflation gas flow, thereby avoiding the necessity of measuring the intra-abdominal pressure while ensuring that a determined pre-adjustable maximum insufflation gas pressure cannot be exceeded. The system comprises a gas delivery line having an inlet end coupled to a source of insufflation gas and an outlet end for connecting to the gas inlet of a surgical laser-equipped endoscope. Angulation knob. The up and down angulation knob is manipulated by the physician's left thumb. The left and right angulation knob is controlled either by the thumb and first two fingers of the left hand or by the right hand. The endoscopist's right hand is primarily used to control the insertion tube, pushing, torquing, and withdrawing as necessary. Eyepiece and video controls. Traditional endoscopes comprise an airtight and waterproof elongated tube having a distal end with an objective lens for imaging and a proximal end with an eyepiece for viewing. The function of the eyepiece is to magnify the image at the proximal end for the observer. Air and water valve, designed to remove coarse deposits and prevent clogging of the air or water channel of the endoscope. The non-pressurized adapter allows airflow through both air and water channels. After pressing, water is directed into the air channel. Suction valve. When depressed, this aspirates air or fluid through the distal tip. This is connected to the accessory channel. A biopsy cap needs to be in situ covering the accessory channel for the endoscope to generate the suction needed. Biopsy channel opening. This allows passage of biopsy forceps and other instruments to undertake therapy. This is covered by the biopsy cap, which creates an airtight seal necessary for the suction channel to operate. Therapeutic endoscopes, such as on the image on the right, may have two accessory channels. These allow multiple instrumentation and are useful in therapeutic settings, example, GI bleed therapy. The umbilical cord. This is made of a flexible tube housing all the channels. The end of the cord is expanded to connect to the processor, a PVE connector, and houses the air and water port, suction port, leak test port, light guide, and the electrical contact. Distal tip of an endoscope consists of 1. The instrument and suction channel, that is at 5 o'clock position, endoscopic view, in a colonoscope, and 7 o'clock position in a gastroscope. 2. First and second light guide which act as a light source. 3. Objective lens allows visualization of the mucosa. 4. Air nozzle to insufflate air. 5. Water nozzle to clear the lens. 6. Water jet nozzle. Water introduced with a syringe through the forward water jet connector comes to this port and gives a more powerful blast of water. Light source. The light source is normally outside the body and the light is typically directed via an optical fiber system. A lens system transmitting the image from the objective lens to the viewer, typically a relay lens system in the case of rigid endoscopes, or a bundle of fiber optics in the case of a fiberscope. Let's look into the types of endoscopes. The abundance of instruments falling under the designation endoscope includes the following with brief descriptions of each. Amnioscope, used to examine the fetus through the cervical canal prior to membrane exchange. Angioscope, used to examine the interior of blood vessels. The scope must thus be very long, slender, generally on the order of 0.5 millimeters, and flexible to accommodate navigation of minute spaces and dynamic curvature. Arthroscope, used to examine intra-articular surfaces of joints. Arthroscopes are rigid and contain stacks of optical lenses, while the eyepiece is generally attached to a video camera. Due to the frequency of knee injuries, the arthroscope is most often used to diagnose and help treat knee damage. Bronchoscope aids in exploring the interior of the bronchi, their branches, and tracheal mucosa, the windpipe tissue lining. Choledocoscope, used to examine the bile duct, the duct carrying bile from the liver to the gallbladder or from the gallbladder to the small intestine during an open surgical procedure intraoperatively. Both rigid and flexible scopes are employed. Colonoscope, used to examine the lower section of the bowel, the large intestine, i.e., the colon. Coldoscope, used to examine the pelvis and its structures. The scope is normally introduced through a small incision on the posterior vaginal cul-de-sac. Cystoscope, used to examine the urinary tract and bladder. It employs similar optics to the arthroscope, yet possesses a longer depth of insertion. Cystorthroscope, used to examine the urethra, bladder, and distal ureter. Encephaloscope, used to examine brain cavities. Endoscopic retrograde cholangiopancreatography, used in diagnosis of pancreatic disease through injection of radio-opaque dye into biliary and pancreatic ducts while examining the duodenal area. Enteroscope, used to examine the esophagus, small intestine, and stomach. Esophagogastroduodenoscope, used to examine the esophagus, duodenum, and stomach. Esophagoscope, used to examine the channel connecting the pharynx to the stomach. Gastroscope, used to examine the stomach lumen. Gonioscope, used to examine and help determine the configuration of the angle between the iris and cornea. Hysteroscope, used to examine the passage of the uterine cervix and cavity. Laparoscope, used to examine the peritoneal cavity through the anterior abdominal wall and is commonly rigid. The scope is the most common type used by the general surgeon. Laryngoscope, used to examine the larynx, the sphincter at the entrance of the trachea. Mediastinoscope, used to examine the mediastinum, the mass of tissues and organs separating the lungs, for example, the heart, esophagus, trachea, etc., often used for visualization of lymph nodes and tumors in the superior mediastinum. Nephroscope, used to examine the kidneys, i.e. the renal pelvis, calyces, and upper ureter. It is employed during open procedures intraoperative. Proctoscope, used to examine the rectum. Resectoscope, used to perform resections of tissue as a part of diagnostic or therapeutic procedure. Rhinoscope, used to examine the nasal cavity. Sigmoidoscope, used for direct examination of the sigmoid colon. Thoracoscope, used to examine the pleural cavity through an intercostal space, the space between adjacent ribs, filled by intercostal muscles. Ureteroscope, used to examine the ureter. Urethroscope, used to examine the urethra. And recently, a new technology has been developed called capsule endoscopy. Capsule endoscopy is a procedure that uses a tiny wireless camera to take pictures of your digestive tract. A capsule endoscopy camera sits inside a vitamin-sized capsule you swallow. As the capsule travels through your digestive tract, the camera takes thousands of pictures that are transmitted to a recorder you wear on a belt around your waist. Capsule endoscopy helps doctors see inside your small intestine, an area that isn't easily reached with more traditional endoscopy procedures. Traditional endoscopy involves passing a long, flexible tube equipped with a video camera down your throat or through your rectum. As we know, the application is quite wide in endoscopy systems. We have kept this video as simple as possible in order to help understand as biomedical engineers' perspective. I hope you guys love this video, and if you did,